Thank you for joining us for this Medicare webinar series and tonight's topic, Medicare, Medicaid, and other health insurance options, what you need to know, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for their partnership and support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portion of the presentation. And now it is my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, take it away.
Thank you, Jared. So good evening. Thank you for joining us for our part 4 of the 4-part Medicare 101 series. So this is our last presentation for this series. And we are going to cover a lot of different topics tonight. I will leave plenty of opportunity for questions. I will pause at the end of each section of this presentation to see if anybody wants to ask a question online, or if you have a question, you're welcome to type it into the chat at any time, and I will be happy to address those questions during the pauses. Again, thank you for joining us. Hopefully everybody received the email that I sent out about an hour ago that included the slides for this presentation as well as the accompanying handouts. If you did not receive that email, simply let us know by typing your email address and information into the chat box, and we'll make sure to get that out to you as soon as possible. Other than that, again, please remember to mute until you're ready to ask a question. Otherwise, let's go ahead and get started. All right, so tonight, again, part 4 of our 4-part series, we're going to talk about Medicare and a ton of other health insurance options that might be available to you, other than what we've talked about previously. Quick recap, again, I'm with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. This 4-part series has been in partnership with the Pikes Peak Library District that has a long and distinguished history within our community. Some of you may have found out about this presentation through the Pikes Peak Library District. We're very happy and proud to be part of that partnership and hope to continue it for many years to come. I am, again, the coordinator for the local SHIP office, the State Health Insurance Assistance Program, which is a federally funded nationwide program that provides Medicare beneficiaries and other interested parties with free and unbiased information and education on all things Medicare. This SHIP office here in Colorado Springs covers a total of 9 counties in Colorado. Every county and every state has access to a SHIP program, if nothing else by toll-free statewide number. So I have listed our local Colorado Springs number, which you can access locally in any of the 9 counties that we serve, as well as our statewide toll-free number that will route you to the SHIP office closest to where you're calling from. So a quick review of what we've talked about already in the past few weeks. Week 1, we talked about Medicare A and B, enrollment, eligibility, costs, and coverage. In week 2, we talked about the differences between Medigap or Medicare Supplement Insurance and Medicare Advantage plans. And last week, we focused on Medicare Part D, the newest actual benefit of Medicare, the prescription drug coverage. Tonight, we are going to talk about everything else. So we're going to cover employer plans, including COBRA, retiree health benefits, military benefits, Medicaid, and the marketplace. And we're going to start with employer coverage. So these days, many people are continuing to work past retirement age or past Medicare eligibility age. Again, retirement age is different than Medicare eligibility age because Medicare eligibility is still age 65. But full retirement age for Social Security purposes currently is age 66 and I think 6 months. And that age will continue to increase over the next several years. So someone who becomes full retirement age with Social Security in 2024 may have to wait until they're age 67. So you can enroll in Medicare at eligibility age of 65. But again, many people have chosen or may need to continue to work and be fully employed or have full-time employment past age 65. How that relates to becoming eligible for Medicare? Well, if you are actively employed and you have health insurance through that employment, and that covers you and your family or dependents, you can actually delay enrollment into Medicare, both A and B, until that employment ends. Once that employment ends, if you delayed enrollment into Medicare because you were still working with health insurance, once that employment ends, you actually have an extended period of time to enroll in Medicare without penalty. So you get an 8-month window from the time employment coverage ends to enroll in Medicare without penalty. However, you can also enroll in Medicare at any time while you're still actively employed. So obviously, for purpose of not finding yourself in a situation where you're uninsured, if you know when you're going to stop working or when that employment is going to end, you would be able to coordinate your enrollment with Medicare by contacting Social Security and letting them know when you want your Medicare to start. So again, you can enroll in Medicare anytime while you're still employed and for up to 8 months after that employment ends. Also keep in mind that your employer cannot require you enroll in Medicare when you become eligible if you continue to work. They cannot require that you enroll in Medicare, and really they shouldn't even be suggesting it. The fact that you're actively employed and are entitled to employer health coverage, the fact that you are becoming eligible for Medicare should not factor in at all on how your employer benefits are managed or what you're eligible for through employer health coverage. So keep that in mind. If you do become unemployed, you might be eligible for what's called COBRA coverage. COBRA coverage is, COBRA stands for the Consolidated Omnibus Budget Reconciliation Act, and basically it's commonly referred to as continuation coverage. COBRA coverage is available for people to be able to maintain health insurance in a situation where employment ends or you have a reduction in work hours to where you're no longer eligible for the health plan. This COBRA coverage comes in handy a lot of times for people who are going to no longer be working but have not quite reached that Medicare eligibility age. Usually there can be a gap of a year or a year and a half between the time you decide to stop working and the time you become eligible for Medicare. COBRA coverage allows you to keep your employer plan for up to 18 months so that you're not in a situation where you're uninsured. This also extends to your dependents and your spouse, and can even extend for an extra 8 months for the dependent and spouse in certain situations. Now, how COBRA would coordinate with Medicare really depends on when you become eligible for Medicare and when you become eligible for COBRA. If you become eligible or entitled to Medicare prior to the employment ending, you are able to enroll in COBRA when that employment ends instead of Medicare. However, keep in mind it's not considered creditable for delaying enrollment into Medicare further. Ideally, when you become eligible for Medicare, or if you are eligible for Medicare and your employment ends, you would want to enroll in Medicare. If you choose to do COBRA instead, you still only have that 8-month window to enroll in Medicare without penalty. If you go beyond that 8 months, because you have COBRA coverage for up to 18 months, you would be looking at potential penalties for having delayed enrollment into Medicare. So that 8-month window that you have, that special enrollment opportunity to enroll in Medicare without penalty when employment ends, is something you need to be carefully aware of, because keeping COBRA coverage for the full 18 months is not going to save you from having to pay penalties beyond that 8-month window. If you are entitled to Medicare after COBRA coverage starts, so you were working, employment ended, you were not yet eligible for Medicare, so you took COBRA instead, and then you became eligible for Medicare. In that scenario, you would want to enroll in Medicare immediately when you become eligible. COBRA coverage does not coordinate with Medicare in that scenario. And potentially, if you are eligible for Medicare after COBRA starts, but you choose not to enroll in Medicare, you continue to let the COBRA coverage stay in place. If the COBRA coverage finds out that you became eligible for Medicare, theoretically, they would be able to cancel your COBRA coverage when they find out and potentially backdate when that coverage should have ended to the date when you initially became eligible for Medicare. In that situation, any payments they made for medical services that you received under COBRA during that time could be also taken back by that insurance from COBRA. So the bottom line is, if you are on COBRA and then become eligible for Medicare, your best bet is to enroll in Medicare immediately and drop the COBRA. Now, that COBRA coverage would continue and be extended to spouses and dependents in that situation, so they could stay on COBRA. But you, as the retiree or the employee, would need to enroll in Medicare. There are very few exceptions to that rule, and the rules themselves are pretty convoluted. So it's very rare that somebody would be able to continue COBRA coverage if they're eligible for Medicare without it creating issues. Obviously, COBRA laws and rules can be very confusing. There are a lot of ins and outs, and every scenario has a different rule applying to it. If you are in a situation where you may have COBRA coverage questions or concerns, you're always welcome to call us. We're happy to talk to you about the ins and outs of that coverage. I also included in the email that I sent out earlier a couple of handouts regarding COBRA coverage, including a frequently asked questions from the Department of Labor. It was a FAQ that answers a lot of questions regarding COBRA coverage. Are there any questions about any of those two topics so far? If you have a question, feel free to raise your hand and simply ask it, or you again can type it into the chat at any time and I'm happy to address it. All right, I'm not seeing any hands raised and I'm not seeing any questions in the chat, so we will move on.
I have a question.
Oh,
sorry.
Sure.
I have 1 month in between, like I retired June 30th and my Medicare starts in August because my 65th birthday is August 25th. Do you recommend that I do COBRA for 1 month?
You know, it really depends on your specific situation and how comfortable you are with being uninsured or not during that 1 month period.
Will it make a difference to Medicare if I don't get coverage for 1 month, like, and make sure my doctors take care of me until August?
It would not make a difference to Medicare.
Okay.
No, not at all.
Great.
Yeah, Medicare doesn't care if you've been insured or what kind of insurance you had prior to enrolling in it. Medicare simply doesn't care. They're going to cover whatever you need them to cover. The only time it comes into play is how long you take to enroll in Medicare after you've had certain kinds of other coverage like COBRA. And I see another hand raised. Go ahead.
Okay, can you stay employed and stop your employee coverage and enroll in a Medicare Advantage plan at 65 because it's financially cheaper than paying the premium to work?
Absolutely. And that, of course, is depending on the employer and whether or not they'll let you out if it's outside of, say, their annual enrollment period. But typically becoming eligible for Medicare or enrolled in Medicare is what is considered a life change event that provides, usually most employer plans give you the opportunity to make a change to that coverage or get out of that coverage during a life change event of some sort. You would have to consult with the employer directly as to how that would work in your situation. But if you have the ability to drop the employer plan in favor of Medicare, absolutely, you could do that.
Thank you.
Yep. Any other questions? All right. Then we will move on. All right, so retirement coverage. So if you are fortunate enough to have the ability to extend or be provided health insurance as a retirement benefit from an employer, that is absolutely an option that I encourage people to consider or to look at to see how it coordinates with Medicare, to see what it costs compared to going to original Medicare with another insurance option like a supplement or an advantage plan. In many cases, and obviously depending on the employer, if you're being offered retirement benefits, sometimes those benefits can be very, very good and be specifically designed to coordinate with Medicare. Sometimes not so much. The options can vary with employer retirement benefits quite a bit, and that is because employer retirement benefits kind of play by different rules. The employers, the individual employers, are allowed to create benefits based on whatever criteria they want to create them. Sometimes employers will have you continue the coverage you had while you were still working, but that coverage would simply become secondary to Medicare. Sometimes that coverage option would be customized to look very much like in a Medicare supplement or a Medicare Advantage plan. Sometimes the employer will simply offer through a third-party entity the ability for you to purchase an employer or a standardized supplement or Medicare Advantage plan. Some employers may provide subsidized costs for whatever health insurance options they offer. Sometimes employers will offer you an annual lump sum that you can use to pay towards whatever secondary insurance to Medicare you choose to purchase without them being involved at all. Sometimes it can be a combination of any and all of those things. The other thing you need to be aware of is if the employer is offering retirement benefits, you need to know whether or not the drug coverage, if it includes drug coverage, whether or not that drug coverage would be considered creditable, meaning would the drug coverage that's being offered through the retirement health plan be as good or better than what Medicare Part D provides? Again, I think I mentioned this last week, all employers are required to provide all employees, regardless of age, a letter every year. It's federally mandated. A letter every year that states whether or not the drug coverage offered through the health plan from the employer is considered creditable compared to Part D of Medicare benefits. So that letter is something that you should have from the employer every year, and it will tell you whether or not that drug coverage is considered creditable. When you're looking at retirement health benefits that are being offered through a previous employer, sometimes it's hard to tell whether or not that's a good option. Sometimes it's hard to tell how that would coordinate with Medicare or not, because sometimes retirement health benefits aren't really explained in a manner that implies that Medicare is part of the equation. Because a lot of times retirement health benefits are provided to people who are not yet quite ready to be eligible for Medicare. If you have that option, if your previous employer is offering health benefits, We are happy as an agency and as a SHIP program to help review those benefits for you and help you compare what's being offered to you from the employer to what else is available on the open market, such as supplements or advantage plans. And it would just be a matter of giving us a call and scheduling an appointment. Any information you could get from the employer or your human resources department that tells you what the cost would be in premiums, if any, and how it coordinates with Medicare or not, that is information the employer should be able to provide to you. And any information you can bring with you when we do sit down and look at those options are always very helpful. There are some retirement plans that we are pretty familiar with because we work with them a lot, and we work with a lot of beneficiaries who are eligible for them. So, for example, PERA retirees, Public Employee Retirement Association retirees, which would be most school teachers and public servants. We work with PERA pretty closely, and so we're really familiar with how PERA benefits are structured for retirees. Same with military retirees. So they're federal civil service retirees. So there are some benefits that we are comfortable and familiar with, and other private employers not so much. Again, things to take into consideration, and you should consider these retirement benefits because obviously you work there long enough to earn those benefits. But you'd want to consider those benefits or compare those benefits to the other options. Again, as far as costs, premiums, out-of-pocket, co-pays, deductibles, that kind of stuff. You might also want to look at comparing the drug coverage to make sure that whatever the health benefit is being offered through the employer is going to cover your prescription needs versus, say, a Medicare Part D. You may also want to consider the ease of use of those retirement benefits. If the employer is offering an HMO, but your primary providers don't participate with that HMO, that's something to take into consideration. If you have an employer plan that requires that you work within a network of participating providers, but you intend to do a lot of traveling or extended visits outside of your service area, that would also be something to take into consideration above and beyond costs and coverage. So again, employer plans can be a little confusing simply because they're not standardized. They can be completely customized by the employer to work in any way they see fit, with or without coordinating with Medicare, while some employers simply pay a third party to offer to enroll you in standard supplements or standard advantage plans. So again, if anybody has any questions or concerns or wants to sit down with someone and talk about that in more depth, we're always happy to do that. Any questions about any of that? All right. No questions? No questions in the chat. So we will move on to military retirees and veterans. So I am located in Colorado Springs, and obviously this is a huge military town, and we do have a lot of retired military in our area. If someone has been in the military long enough to retire, meaning they've put in 20 or more years, that retiree, when they become eligible for Medicare, also become entitled or eligible for TriCare. If TriCare was not being used prior to retirement or prior to Medicare eligibility, because some retirees retired when they were 40 and then went to work for civil service or in the private sector, but when they turn 65, they become eligible for TriCare again. If you intend to use TriCare benefits when you become eligible and enrolled in Medicare, keep in mind that TriCare does require you to enroll in Medicare. If you don't enroll in Medicare, you will not be entitled to continue or to enroll in TriCare benefits. When you have Medicare, TriCare standard or prime, whatever you may have had prior to Medicare eligibility, changes to what's called TriCare For Life. TriCare For Life was implemented at the federal level about 20 years ago when I first started this job. And it was a lifetime benefit that had been promised to military retirees for many, many years and was finally passed at the federal level and implemented, I believe, in 2005. You do have to have put in 20 years of service and have been honorably discharged. If you enroll in Medicare and you get TriCare for Life automatically, you would not need to worry about enrolling in a Part D drug plan. TriCare for Life benefits come with TriCare drug benefits, which are considered as good or better than Medicare Part D. So if you get Medicare and TriCare for Life, you would not need to enroll in a Part D or any other kind of health benefit that would be associated with Medicare. So you would not need a supplement, you would not need an Advantage plan, you would not need a retirement benefit. Any benefit you enroll in addition to TriCare and Medicare, and you can enroll in other benefits in addition to TriCare and Medicare, but any other benefit you enroll in that's related to Medicare would become your secondary, or in an Advantage plan scenario, your primary insurance. TriCare would become the payer of last resort. Honestly, if you are eligible for Medicare and TriCare for Life, I can tell you my personal opinion is that is literally the best combination of coverage you can have in this country today. It does not get much better than Medicare with TriCare for Life. And if you've put in that 20 years of service, that is certainly a benefit that you have earned and should take advantage of. TriCare for Life does not cost anything. There is no monthly premium, and it acts and works very much like a Medicare supplement. It pays all your Medicare deductibles, your 20% coinsurances, and again, it includes Part D drug coverage. So it's better than a Medicare. It's better than the best Medicare supplement plan level you can get. The only thing you have to do when you become eligible for Medicare, if you want to access TriCare, is to contact your local DEERS office and let them know that you're getting Medicare, and then send them a copy of your Medicare card when you get it. If you want more information, I've provided the website tricare.mil/TFL for TriCare for Life. And it does have actually some very, very good information and very comprehensive information on Medicare and TriCare for Life. If you are a veteran, but you did not retire, you didn't have 20 years in, but you may still be eligible for veterans benefits through the VA. I get a lot of veterans, again, who ask me if they need to enroll in Medicare, if they use all of the services or get all of their primary health care through the VA. And my answer is always maybe, or honestly, more likely, probably. To be eligible for veterans benefits, that eligibility is determined by the VA directly. It can be based on disability status or income status or medical need status. If you're approved for VA services, typically it's going to be for the use of their medical services and facilities, including their pharmacy. Enrollment in Medicare is not required for enrollment in VA services. The thing you need to keep in mind about Medicare and VA is the two do not coordinate with each other. So VA services will always provide you care that you're eligible for based on VA entitlement. Medicare will always pay for services that you're eligible for based on Medicare entitlement, but the two do not coordinate with each other. They do not act as primary or secondary. They are two separate entities, two separate worlds, basically. You can have both, and honestly, I usually encourage people to get both. The upside of having Medicare, even if you access most of your services through the VA system, is that Medicare is good everywhere for any medically necessary reason at any time. They do not care about any other factor other than that you have Medicare and you need a medical service. Whereas VA, you may be limited to where you can get services because VA's facilities are limited to certain areas. So people who live in very rural areas may have a harder time accessing the healthcare benefits through the VA system because they are a long distance from the closest facilities. And VA will only treat people for VA-related needs. So again, it's apples and oranges. VA can be more limited, but if it is taking care of all your needs, it doesn't usually cost anything. It provides good drug coverage, and a lot of people want to continue to use it, and you can. But you can also have Medicare that is good anywhere for anything at any time. Yes, you have to pay for it, but in many cases, it could be worth it. If you choose not to enroll in Medicare because you use the VA system for all your needs, but down the road, you decide maybe having Medicare is going to be advantageous for you, keep in mind that VA is not considered a credible reason for not enrolling in Medicare, and you would be penalized for not having enrolled in Medicare sooner. So there are penalties, potential penalties related to not enrolling in Medicare in favor of VA. But again, having both can be very, very advantageous because it gives you the confidence to know that no matter where you are or what you need, you will have the coverage that you need. VA services also provides long-term care services and supports. So even if you do not access the VA services now, if you're eligible for them, in the future, you could still look at accessing VA services for potential long-term care needs, such as long-term care facility stays, or respite, or hospice, or even in-home care, depending on your situation. If you want more information about VA services, you can go to their website, va.gov. You can also contact your local Veterans Service Center office. There is one in every county, and they are always happy to talk to you about your eligibility. And if it appears that you might be eligible for benefits, they will also help you with the application process. Any questions about retired military or VA? Again, you can type it into the chat or simply raise your hand and ask your question. All right, I see no hands raised. I see no chats. So we will move on to Medicaid. So a lot of people ask me, can someone have Medicare and Medicaid at the same time? Absolutely. What a lot of people don't realize is that there are lots of different kinds of Medicaid. In Colorado alone, we have over 40 different kinds of Medicaid programs, depending on someone's situation. Medicaid versus Medicare. Medicaid is typically going to be a state-run program, and it's going to be a needs-based program. And when I say needs-based, I mean needs based on financial situation or health situation. Versus Medicare, which is a federal program that we all pay taxes into to become eligible for and entitled for at a certain age. Medicaid is available to anybody based on their scenario, on their individual situation at any age. For most people who are eligible for Medicaid, they are going to be under age 65 or not eligible for Medicare yet. And when 2014 and the Affordable Care Act went into effect, Medicaid was able to expand eligibility so that more people who were otherwise uninsured or uninsurable were able to become eligible for Medicaid and be able to have health benefits to take care of their health needs. Prior to the Affordable Care Act, I talked to many, many people who were in situations where they found themselves uninsured, lost employment for whatever reason or something like that, and had health issues that made them otherwise uninsurable. They could not pass underwriting with health insurance companies. So they were kind of in a limbo where they had no health insurance and they had health issues. And there was very few programs out there that would help these people. But when the Affordable Care Act went into effect and it expanded the eligibility for people to qualify for Medicaid, it was truly beneficial for that entire demographic of people. Again, there are many, many different kinds of Medicaid, and that varies based on financial need or medical situation. If you have Medicare and Medicaid or Medicaid and other types of coverage, keep in mind that Medicaid will always be the payer of last resort, meaning they will always be the last to pay for any services or claims. And any other insurance that you might be eligible or enrolled in would be the primary payer. There are Medicaid programs specifically for people with Medicare, regardless of age. We've mentioned them before the last couple of weeks. They're called the Medicare Savings Programs. Technically, these programs are not Medicaid because these are assistance programs that are financed directly from federal dollars and not state dollars. But in order to enroll or apply for these benefits, you have to go through the state's local Medicaid system. So to get the Medicare Savings Program and to do an application for Medicare Savings Program, you actually have to do a Medicaid application, even though technically it's not Medicaid. Again, Medicare Savings Programs only assist with the costs of Medicare, such as the Medicare Part B premium, or if you are at a lower income scenario, it could pay the Medicare premium and the costs after Medicare paid first that they left over, such as the deductibles and coinsurances. There are other programs that are specific to age or disability beneficiaries that may not quite be on Medicare yet. Old age pension, or otherwise known as OAP, is actually a cash program, a cash benefit that provides supplemental cash income for people whose actual Social Security income is below a certain standard or threshold. Or it can supplement SSI benefits, supplemental security income benefits from Social Security. That is always going to be at the federal poverty level or less. It can increase those benefits a little bit and get you over that threshold a little bit. Long-term care Medicaid programs are probably some of the most commonly used benefits through the Medicaid systems in any state. Long-term care programs include not only long-term care in a nursing facility, but more preferably, it provides benefits to receive care at home in a community setting. And it's called Home and Community-Based Services, and it provides, it allows people to stay in their homes in the community by being able to provide home health care workers to come to them in the home to help with activities of daily living, such as dressing and bathing and stuff like that. It is more cost effective for the state, and it is more preferable for everybody because it allows you to stay at home. It can also cover assisted living costs. So if you are not quite able to stay at home independently, but you're not in a situation where you need to be in a 24-hour skilled nursing facility, there are assisted living facilities or alternative care facilities. And the long-term care Medicaid benefits could cover the cost of room and board in those facilities. There are, as with all Medicaid programs, income and asset limits for all of these programs, and each program has its own income and asset limits. So any specific program that someone might be interested in, we would have to look at that program individually as far as what the income and asset limits are to qualify. In addition, for the long-term care programs, you also have to meet physical eligibility. I've provided this information before in the last couple of weeks. This is the income and asset limits for the Medicare savings programs. The income and asset limits for the Medicare savings programs can be higher than for many of the other Medicaid programs because, again, this assistance program only deals with the costs of Medicare itself. Income limits for the three different levels of Medicare savings. The different income levels are going to vary based on what benefits you may qualify for. At the higher income level, you're going to qualify for perhaps the state to pay that Part B premium, so that it is not deducted from your Social Security income every month. And at the lower income range, you may qualify for the state to pay your premium and to pick up any costs Medicare left over after they pay first for any services. Also has asset limits. And when I say assets, I am talking about liquidatable assets, such as checking, savings, investments, properties that you don't live on, those kinds of things. They are not going to look at your home that you live in or the property it sits on. They're not going to look at your personal possessions. They're not going to look at your primary vehicle, but they will look at all other types of assets that you may have above and beyond that. Anybody who has questions or wants more information about these programs are always welcome to contact us. Not only will we help you determine if you're eligible for these programs, that we also help with the application. Any questions about any of that? If you become eligible for Medicare Savings Program, you do also automatically become eligible for the help on your drug coverage with Medicare Part D, called Extra Help or Low Income Subsidy. So if you qualify for one, if you qualify for Medicare Savings, you automatically qualify for extra help on your drug coverage. On the reverse, because the income and asset limits for help on drug coverage are higher than the income and asset levels for Medicare Savings, more people would potentially be eligible for help with drug coverage than would be eligible for help with their medical costs. And again, we do help with screening and applications for both of those programs. Just give us a call and we're happy to talk to you about that. So again, any questions about any of that? This is another handout I included in the email I sent earlier, just kind of gives you a written version of that information about the Part D extra help and the Medicare savings programs, gives you the current income and asset limits. All right, I'm not seeing any questions. I'm not hearing any questions, so we will wrap it up. We're almost done. We'll get you out of here early tonight. So the last thing we're going to talk about is the marketplace. Marketplace is, again, another mandate from the Affordable Care Act that went into effect in 2014. Colorado, the state of Colorado, chose to manage our own marketplace system and benefits versus having it managed by the federal government. In Colorado, our marketplace is called Connect for Health. Connect for Health coverage, which is basically private insurance that is available to anybody and everybody for a monthly premium. It is provided at many different levels of coverage for a wide range of costs. There are tax credits and premium subsidies that could be available for people who are on more limited income. And you can price the costs through the Connect for Health website, connectforhealthco.com, between the different levels of coverage without actually having to enroll in anything. If you go to that website and do a search or a comparison, it will also help you determine whether or not you're eligible for tax credits or premium subsidies. It will also screen you to see if you are eligible for Medicaid. So for people who go to this website, it's going to ask some general income and asset questions to try and determine whether or not you're eligible for Medicaid. If you are over the limits for Medicaid, you may still qualify for the tax credits or premium subsidies so that you have reduced costs or Connect for Health coverage, or it'll tell you don't qualify for both. Either way, at the end of that, you can still look at all the different plans that are available and see what their premiums would be, what their deductibles are, what their copays look like, all of that kind of thing. Marketplace coverage is typically limited and for enrollment periods to their annual enrollment period, which is I think December 15th through just January 15th each year. Although there are other scenarios, life change events, or other certain situations that would allow you to enroll in this kind of coverage or get out of this kind of coverage outside of the annual enrollment period. For someone who has not been employed or has not needed to be employed, but has not been eligible for Medicare prior to, recently or now, Connect for Health marketplace coverage was a good option because it allowed you to buy health benefits regardless of health. So the most important mandate of the Affordable Care Act is that it restricted insurance companies from being able to underwrite in most situations. So for people who weren't eligible for Medicare and didn't otherwise have health insurance, you could always go to Connect for Health and buy health insurance if you needed to. For people who are eligible or enrolled in Medicare, a couple of things to keep in mind. The only way you can have both Medicare and a policy through the marketplace is if you have to pay for Medicare Part A. So if you're not entitled to Medicare Part A at no cost, you can still enroll in Medicare most of the time, but you have to pay that monthly premium, which I think was over $500 this year a month. So you either have to pay for Medicare Part A. In a situation where you would have to pay for Medicare Part A, you could opt not to enroll in Medicare Part A and get marketplace coverage instead. If you are entitled to free Part A and you have marketplace coverage and you choose to keep both, keep in mind that even though you probably shouldn't because it's not in your best interest financially to have both, if you were receiving any tax credits or premium subsidies, those would go away when you become eligible for free Part A, and you would start having to pay full premium for marketplace coverage if you choose to keep it. And keep in mind that if someone knows that you are enrolled in Medicare, they are not allowed to sell you a marketplace plan because really you shouldn't have both. If you are enrolled in marketplace coverage because you have not been eligible for Medicare prior to now or coming up, once you become eligible for Medicare, you really should drop the marketplace coverage. Above and beyond the fact that it becomes very unaffordable to have both because now you're paying premiums for both coverage. Again, it's not considered creditable coverage for delayed enrollment into Medicare. And so it wouldn't waive any penalties if you continued with marketplace coverage, even though you're entitled to premium-free Part A. But it's really not going to coordinate with marketplace coverage either. So Medicare and marketplace coverage really will not coordinate with each other. So again, if you become eligible for Medicare, if you're on marketplace coverage, you need to enroll in Medicare and drop the marketplace. Or keep in mind that you shouldn't have both unless you're in a situation where you have to pay for Part A. And in that situation, it might be more cost effective to go with marketplace coverage than it is to pay for the premium for Part A, depending on the situation. If you have Medicare, even though you can't get health insurance through the marketplace, you can still shop around for dental coverage through the marketplace. The marketplace does offer dental insurance options in addition or separately from the health insurance benefits. So if you are in need of dental coverage, again, when you have Medicare, original Medicare is your primary insurance. Medicare itself does not pay for dental. The only way you can usually get dental is if you enroll in an Advantage plan. But if you keep original Medicare, you can shop around for dental coverage by any means you see fit. If it's not a benefit of Medicare, you can get it any way you want, any way you can find it. And the marketplace would be a good option to do some shopping around for dental benefits. And as with COBRA, marketplace rules can be a little confusing when it comes to Medicare. I did include, I hope, a FAQ about Medicare and marketplace coverage in the email that I sent out earlier. If I did not get that inserted, someone please let me know and I'll make sure to send that out afterwards. But if you have questions about marketplace coverage and Medicare, please feel free to give us a call. We're happy to talk to you about the ins and outs of that. And that is all I have for you guys tonight. Any last questions or comments before we wrap it up? All right, I'm hearing no questions. I'm seeing no questions in the chat. So I will let you guys get on with your evening. Oh, wait. Oh, I appreciate that. So I am seeing some comments come in. I appreciate the thanks. I appreciate everybody who has attended and hung in there with us for the last 4 weeks. I know it's been a lot of information to cover, and I appreciate your interest in this class and in this process. And as always, we are always available to talk to you one-on-one about any of these topics that we've covered in the last 4 weeks. You're welcome to email me. You're welcome to call us. We're happy to schedule an in-person appointment. Again, at the end of this, you will get another email that includes a survey. We always appreciate your feedback and suggestions on future class topics. Other than that, I will let you all go and enjoy the rest of your evening. And thank you again for joining us.